People only hear about these kinds of places when something really bad happens.
There was a lot of criticisms about life in these asylums, but at the same time, you could argue it was better for someone to be confined in a hospital than it was for them to simply be thrown out on the street.
Drugs are not a cure-all. So many people today with mental problems and all that are committing suicide. They're left to their own demise, and they're just handed drug after drug after drug.
But still, nobody wants to talk about mental illness, and nobody wants to talk about the way mental illness was treated through most of the last century.
And they looked at these rambling old state facilities, and they said, well, here's Peoria State Hospital. It's 100 years old. In actuality, it was only 73, but I guess who's counting? Withholding money to do the maintenance and the upkeep.
The superintendent at the time was blamed for it. The staff were blamed for it.
Every time our state gets in trouble, and they've been in trouble for years and years and years financially, they look at mental health as a way to cut the budget.
There was a great upheaval, among the employees, people who were running the show. It was obvious what was going on. It was a political ballgame. But we lost, of course, as everybody knows.
And he's like, I've never seen a file this thin before. She had turned all the pictures to face the wall because she thought everybody was judging her, and she was horrified.
Such an innovator, and he was so far ahead of his time.
He doesn't get the recognition, I don't think, that he may have deserved.
Mental illness is something that is so individual that you can't really have a whole system that treats everybody equally. A lot of these illnesses were simply lumped together as insanity.
People need to know more about mental health. I don't think they understand.
The institutions physically crumbled and psychologically crumbled.